out into the future, to your future yous, and let's imagine that we're all 85. Now, everyone look at two people. One of you probably has Alzheimer's disease. All right. And maybe you're thinking, well, it won't be me. Then, okay, you are a caregiver. So, in some way, this terrifying disease is likely to affect us all.
Imagine waking up one day and the world as you know it starts to disappear. Not all at once, but bit by bit. That's the reality for millions of people with Alzheimer's disease. In just the last decade, Alzheimer's cases have surged by 224%, and it's not slowing down. Alzheimer's, a disease affecting millions worldwide. It's more than just memory loss. It steals the future. It's a form of dementia that causes fundamental changes in our brain. But where did this disease begin? In 1901, German psychiatrist Alois Alzheimer began studying a peculiar patient. Auguste Ditter, a 51-year-old woman, was experiencing unexplainable memory loss and behavioral changes. Dr. Alzheimer analyzed her brain and, after her death, made a startling discovery during autopsy. Her brain had shrunk significantly more than normal aging would explain, suggesting a new form of disease. In 1907, Dr. Alzheimer published a paper detailing his findings on this new brain disorder. He argued that these brain changes weren't just part of normal aging, but a serious neurodegenerative disease. This paper became the foundation for dementia research, and in 1910, the condition was named Alzheimer's disease after him. Alzheimer's is a disease where brain cells are progressively destroyed. Neuroscientist Lisa Genova explains in her TED Talk how this disease damages our brains. Alzheimer's causes beta-amyloid plaques and tau protein tangles that disrupt connections between neurons. Over time, these blockages cause neurons to die, and this cellular damage affects not only memory but also cognitive abilities and emotional regulation. Why is finding a cure for Alzheimer's so challenging? The disease damages complex neural structures, and any treatment must affect many areas of the brain. Moreover, Alzheimer's often doesn't show clear symptoms for years after onset, making early diagnosis and timely treatment difficult. One common difficulty Alzheimer's patients face is a strong desire to go home. A nursing home in Germany created a fake bus stop to address this. Patients can wait there and calm down, allowing nurses to safely bring them back to care. This is an innovative way to minimize confusion for Alzheimer's patients.
Why would you want to build an authentic-looking, yet completely fake, bus stop? The answer lies in the building right behind the bus stop. It's an old folks home called the Benrath Senior Center. The center houses many elderly people plagued by dementia and Alzheimer's that are relevant to the fake bus stop. People affected by dementia are often disoriented, restless, and mentally live in the past. This causes many of them to suddenly want to go back to their old jobs, old homes, or long passed away parents. As you can already guess, the fake bus stop literally stops old people from wandering off when they try to go back to their old lives. They step out of the senior center, see the bus stop, sit down, and wait for a bus that will never arrive. Without the bus stop, patients would continue walking. This is a serious problem, with countless stories of seniors ending up in different cities, in forests, rivers, or even going missing forever. So nurses often accompany patients outside the center and sit them down at the fake bus stop. That way, they feel like they are progressing towards their destination. All the while, they are calming down in the fresh air, and the patients end up forgetting why they came to the bus stop in the first place, and calmly come back inside the senior center. The concept has caught on, as it makes the lives of nurses and staff a lot easier while keeping seniors safe.
While Alzheimer's patients lose memories, their emotions remain. Though they may forget your name, they still feel joy, sadness, and fear. Families can maintain relationships based on these emotions, and the love and safety patients feel are crucial parts of their care. Currently, about 50 million people have Alzheimer's, and this number is rapidly increasing. By 2050, it's estimated that 150 million people could have Alzheimer's. This is why Lisa mentioned in her TED Talk, If you live to be over 85, you'll likely face one of two scenarios. Either you'll have Alzheimer's, or you'll be caring for someone who does. But there is hope. Artificial intelligence and cutting-edge technology are helping detect early signs of Alzheimer's faster. Ongoing research is opening new avenues to prevent and treat this disease. Together, we can work towards a better future. While Alzheimer's takes away our memories, it doesn't take away the essence of a person. Their emotions are still alive, and we can be there for them, providing love and support.